Good morning, good evening, good afternoon, and hello to all our audience from all over the world because it's all different timings in different zone, and therefore I am addressing everybody. This is your host, Ashok Basin. I will be your facilitator for today's topic, which is the mission of Thyroid Federation International and why it matters for thyroid patients. Today is June 15th, 2026, and we have been doing webinars for a long time uh, from Thyroid Federation International. But this time we thought that it would be a good idea if we inform our followers, stakeholders, and all the other patients in terms of what we really do and who are the people involved in doing all this. So that is why we went with this. Before we go ahead, to the second slide. And on the second slide, I would like to thank our sponsors, Merck, Amgen, Argenex, Viridian, Egetis, and Immunovant, and IPSA for the support that they are giving us, without which this would not be possible. And we thank them for doing this. With Merck, we have had almost 20 years of partnership on International Thyroid Awareness Week. So thank you very much. And I would like to now introduce the speakers. So the speakers today are going to be Linda Henderson, who's our Vice President for TFI, Beata Bartes, who is our Secretary for TFI, and Julia, who is our Treasurer, and Rocco, he's one of our directors on the board, and so is Nancy. And Catherine, she is our coordinator. She may not be speaking, but she has been with us for a very long time. We'll give you a snapshot on her. And Anna, who's our communication director. And finally, I will be speaking to you. So over to Linda Henderson.
Hello, I'm Linda Henderson, TFI Vice President. I have been with TFI for about 8 years. As Vice President, I focus on alignment so everyone stays connected, heading towards the same direction and goals. I have been involved in several projects, primarily concentrating on awareness campaigns to increase knowledge of iodine deficiency diseases. Mother-baby iodine began as a concept several years ago while brainstorming with board members and Dr. Teo St. Louis from the Philippines. He personally, and with great enthusiasm, promoted mother-baby iodine through his travels with the Thyromobile, bringing awareness on the importance of iodine in women of reproductive age. Mother-baby iodine is a joint initiative with WIA, IGN, GAIN, Nutrition International. While general progress has been made internationally to assure optimal iodine nutrition among school-aged children, pregnant and lactating women lag behind and still constitute the vulnerable segments of population. Iodine deficiency among pregnant and lactating women who bear children will have impact on the brain development of fetuses while still in the womb and into the next 2 years, which may no longer be corrected thereafter. Children's IQ may drop as much as 5 to 10 points in mild IDD and by 10 to 15 points in moderate to severe iodine deficiency. Education and later productivity may suffer. Another initiative is a booklet called Mr. Yodi and Little Salty Best Friends, written by an Italian team and translated into English by TFI. It's an educational booklet for primary school children on the importance of iodine, where to find it, and how salt and iodine work together. It's a whimsical little book and fun illustrations. I was invited to the first World Iodine Association meeting in Pisa in 2017, entitled Iodine in Food Systems and Health. The meeting included stakeholders from the scientific, academic, and medical community, as well as the industry and other policymakers. TFI brought forward the importance of patients as well. We have been invited to participate in the meetings that followed in Rotterdam and Baveno, Italy, and will be present next November in their meeting in Brussels. The first EU Thyroid Consortium evaluation of iodine deficiency in Europe uncovered major limitations in awareness of the importance of iodine nutrition. EU Thyroid 2 is a 4-year project that builds on the findings of the first EU Thyroid and works to inform children, adolescents, and young women about the importance of iodine for their own health and that of their offspring. Interventions are ongoing, focusing on education in schools and healthcare settings across Europe and beyond. The Iodine Coalition Europe is a partnership dedicated to ensuring adequate iodine nutrition. Our joint goal is to tackle iodine deficiency in Europe. The coalition brings together iodine nutrition experts, representatives of salt, food, and iodine industries, research, and patient organizations. An interesting quote for patients' perspective. Patients' experiential knowledge is increasingly documented as a valid form of knowledge in the health sector and is often said to be a source of valuable information to complement the knowledge of health professionals. It's become important to have patient organizations working together with physicians and health officials and governments. Patient education is important, but also informing healthcare professionals, doctors, specialists about patient experiences. Thank you.
I am Beate Bartes, the Secretary of TFI. I joined Thyroid Federation International in 2003, and I have been the Secretary since 2004. I am German, but I am living in France, working as a translator and interpreter. I was diagnosed with thyroid cancer in 2000. Shortly after my diagnosis, I created a small French online forum for thyroid patients to share my experience and to share the information I found during my cancer journey. The forum Vivre sans thyroïde, Living Without a Thyroid Gland, quickly grew and became a non-profit association for French-speaking patients concerned by different thyroid diseases from France, from Belgium, Switzerland, Quebec, North Africa, various African countries. My organization cooperates with health authorities, national and international organizations for rare diseases. I'm a patient representative in several medical networks, such as the French TUTIREF network for refractory thyroid tumors, the European Endo-ERN network for rare endocrine diseases, and the EURACAN network for rare adult solid cancers. I have always been interested by networking and exchanging experience between patients and organizations from different countries. As a former translator, I speak English, German, and French. When I attended my first TFI AGM in Edinburgh in Scotland in 2003, I was immediately convinced of the importance of a really global organization. This was also the occasion to attend my first international congress, the ETA meeting. Since then, I made connections with many doctors and doctors' organizations, and I attend all major thyroid congresses and conferences in France and all over Europe and beyond. At the AGM in 2004 in Istanbul, Turkey, I was elected the Secretary of TFI, and I have been the Secretary ever since. My main job is to prepare meetings and to do the minutes. I also took over the responsibility for TFI's annual Thyroid newsletter in 2010 from the former editor Juneros Beatty. Here are some pictures from different thyroid congresses and annual general meetings of TFI over the years, in Paris, in Quebec, in Poland, and in Italy. Since 2010, together with an editor team, I prepare the annual newsletter Thyroid each year, which is distributed to all attendants of the annual ETA meeting and of other congresses, Latin American Thyroid Society, American and Oceanian Thyroid Association, American Thyroid Association, and so on. Our newsletter contains articles from doctors about important findings in the thyroid field, information about the activities of the Federation throughout the year, and activity reports from our member organizations. I am passionate about meeting and interacting with doctors from other countries, and I represent our French organization and the TFI at various conferences and congresses in France and abroad, including the European Cancer Congress in Brussels, the European Congress of Endocrinology, the Congress of the African Society of Endocrinology, Metabolism and Nutrition, the annual meetings of the European Thyroid Association, the American Thyroid Association, and many others. In these congresses, I represent TFI and the thyroid community with a booth, and I give talks to present the patient's perspective. I also serve as a link between TFI, who uses English as its working language, and the new French-speaking member associations in Africa. Here's some pictures from recent thyroid congresses. The European Cancer Summit in Brussels, the African Endocrinology Congress in Ivory Coast, the International Thyroid Congress in Rio de Janeiro in Brazil. Thank you.
Hello everyone, I am Giulia Giambolini, Treasurer of Thyroid Federation International. I have been also involved in the organization and management of endocrine patient associations in Italy, including CAP Italia and La Lumaco DV. These organizations were founded by patients with endocrine disorders to strengthen the connection between patients and the medical and scientific community. I am also a certified Eupathy expert patient, having participated in the European Patients Academy initiative, which promotes patient education and engagement in medicine's research and development. Over the years, I have contributed and continue to collaborate on several national projects focused on iodine prophylaxis in Italy. Many of these initiatives have been implemented in schools through partnership with the Italian National Institute of Health and the Ministry of Education. I have also been involved in public awareness campaigns that offer free thyroid ultrasound screenings for both children and adults during dedicated health awareness events. TFI around the world. Where are our member patient associations located? As you can see from the map, the countries highlighted in blue represent those where TFI member patient associations are present. Our members are spread across the globe, with organizations based in North America, including the United States and Canada, as well as in Asia, Africa, and many countries in Europe. This global network allows TFI to bring together the voices and experiences of thyroid patients from different regions and healthcare systems around the world. We also have affiliated organizations from countries such as Bangladesh, Philippines, Nepal, Ecuador, and Egypt. Affiliated members are organizations that are not patient associations but are closely connected to TFI's mission. These include scientific societies and organizations representing healthcare professionals such as physicians, nurses, nutritionists, and other medical experts. Their involvement helps strengthen collaboration between patients, healthcare professionals, and the scientific community, supporting our shared goal of improving thyroid care and patient outcomes worldwide. Our annual general meeting. We hold our annual general meeting every year in the same city and a few days before either the European Thyroid Congress or every 5 years the International Thyroid Congress. The AGM brings together TFI board members and all TFI member associations are invited to participate. During the meeting, we review the annual financial report, present the activities and projects carried out throughout the year, and discuss and propose new initiatives for the year ahead. An important part of the AGM is the opportunity for member associations to introduce themselves to the network. Each participating association gives a presentation about its organization, its activities, ongoing projects, achievements, and future plans. This exchange allows all members to learn from one another, share experiences and best practices, and stay informed about the many initiatives taking place around the world to support and improve the lives of thyroid patients. As you can see from the photos on the right, during the most recent International Thyroid Congress held in Rio de Janeiro, we had the opportunity to meet a large number of endocrinologists and endocrine surgeons from all over the world. These events provide an excellent opportunity to increase the visibility of TFI, connect with both patients and healthcare professionals, and strengthen collaboration with the international scientific community. We also allow us to raise awareness of TFI's mission and expand our network by reaching as many people as possible within both the patient and medical communities. The International Thyroid Awareness Week is an annual initiative held every May. It is an important opportunity to raise awareness about thyroid diseases and the challenges faced by thyroid patients around the world. Each year, a different theme related to thyroid health is selected to highlight a specific aspect of thyroid disease and patient care. The theme for International Thyroid Awareness Week 2026 is Thyroid and Nutrition, emphasizing the important role that proper nutrition can play in supporting the management of thyroid disorders and overall patient well-being. On the occasion of International Thyroid Awareness Week, TFI organized a variety of initiatives to promote education of awareness among patients, healthcare professionals, and the general public. This year, TFI hosted a webinar led by Professor Leonidas Duntas, focusing on the close relationship between nutrition and thyroid diseases. The webinar explored how dietary habits and nutritional factors can influence thyroid health and contribute to the effective management of thyroid disorders. The theme chosen for International Thyroid Awareness Week 2025 was Thyroid Disease and Artificial Intelligence. The campaign focused on how artificial intelligence can support the diagnosis, treatment, and management of thyroid diseases, helping healthcare professionals improve patient care and outcomes. TFI hosts its own webinars. What is a webinar? A webinar is an online seminar allowing participants to attend remotely. These sessions provide an opportunity for patients, healthcare professionals, and researchers to learn about specific topics related to thyroid diseases, hear from experts in the fields, and engage in discussion and question and answer sessions. You can find all the webinars organized by TFI on our YouTube channel, where recordings of past sessions are available to watch at any time. These webinars cover a wide range of topics related to thyroid diseases and feature internationally recognized experts who share the latest scientific knowledge and practical advices.
Hello all, I'm Roko Granic. I'm a thyroidologist from Croatia. I have been a member of TFI for several years and have been board member at large for 3 years. What is TFI about? It's about work. Long hours dedicated to the same cause, patients' advocacy, speaking for those whose voice is not always heard clearly, sending endless emails, correspondence, organizing meetings, symposia, attending all relevant international meetings about thyroid disease. It's about dedication. I'm fairly new at TFI, but there are those of us that have dedicated many years, even decades, to this cause. For years and years, attending our annual general meetings, speaking with stakeholders from medical profession, industry, and especially with patient community. Keeping the relationship with our friends in thyroid patient organizations all over the world. We have members from Europe, Africa, Asia, the Americas, all united in the same noble cause, ensuring that the patient's voice can be heard. TFI is about spreading the word. At countless meetings and symposia that we attend through the years, with direct contact and conversation at our booth, speaking at medical conferences, especially celebrating World Thyroid Day, 25th of May. We have many printed materials like leaflets about TED and TFI. We have websites, TFI website, Mother Baby Iodine website, International Thyroid Awareness Week website. We participate in many international projects. We have a Thyromobile project. But especially, I would like to emphasize our yearly magazine, Thyro World. The printed version is inserted in every attendee's bag at the main thyroid symposium of the year. Thyro World started several decades ago, and the content usually includes reports from meetings, symposia and events, news from the thyroid field, activity reports from member organizations, interviews with distinguished thyroidologists, mementos of our past members, and of course future plans and projects. TFI is about patients. Our core duty and goal is to help patients connect, organize, influence and promote awareness of thyroid disease. Cooperation, friendship and support is in our core. TFI is family, first and foremost. TFI is a true family. It has its highs and lows, its fights and celebrations, its quarrels and successes, like every normal family. But we stay together. Join our effort, dedicate your time for a good cause. Join our international family in supporting thyroid patients all over the world. Thank you and good luck.
Hello, my name is Dr. Nancy Ward Patterson. I am with the Thyroid Federation International, as well as the founder of the Graves' Disease Foundation in the United States. I'm going to start with my journey through Graves' disease and thyroid eye disease. Back in 1987, I was driving home from the beach. I had just recently finished getting my PhD in stress management and how to manage it. And I'm driving home from the beach, and my heart is pounding so hard that I can see my shirt bouncing up and down. And the part of me that had just finished her PhD went, "Oh, you're under too much stress." And the nurse in me, which I had been for several years, went, something's wrong. You need to go to a doctor. So the next week, I went to a cardiologist who did a lot of tests, a lot of blood tests, and a lot of EKGs and things. And at the end, everything was, excuse me, relatively normal. But he said, "I want you to wear a heart monitor and then come back tomorrow. I have one more blood test I want to do." Well, and this was 1987. Back then, a heart monitor was as big as a laptop computer, and there was no way I was going to wear it. So rather than say, "No, sir, I'd rather not do that," I just never went back to him. What I know now is the next day he would have done a TSH and I would have known what was going on. I went to another cardiologist who kept me for several weeks, and after I passed out on the walking machine, they sent me to an endocrinologist who did a TSH test. That's a thyroid stimulating hormone test, which came back that I had Graves' disease.
Hello, my name is Anna Bokor and I'm Communications Director. I have been with TFI for over 6 years and I work to advance thyroid education and advocacy. Education is at the heart of what I do, with the aim to elevate knowledge and awareness of both thyroid health and thyroid disorders. We reach the world with multi-channel communications pathways, global campaigns, strong global social media outreach, webinar series, and evidence-based educational materials. We are especially grateful to being connected to a growing global community of thyroid patients and also grateful to connect with healthcare professionals, leaders in endocrinology, surgery, iodine experts, partners across projects, researchers, industry, and other stakeholders across the world. I believe in educating with infographics always. Having patients recognize early signs and symptoms is very important. Patients want to understand what's going on. They want to know what's happening. That single moment of recognition that certain symptoms point to something that needs to be treated, that very moment may change the entire patient journey. When it comes to education, prevention is also key. 50% of Europeans' newborns are at risk of iodine deficiency. Leading communications and dissemination within Euthyroid-2, a public health research project, means for TFI increasing knowledge and awareness about iodine. Euthyroid-2 conducts interventions in schools and healthcare settings in Europe and beyond with the aim to inform adolescents and young women about the importance of iodine for health and the risks of iodine deficiency. I'm also involved in Iodine Coalition Europe, a partnership that aims to drive policy change at the European level and works to make iodine accessible across Europe to protect future generations from the health consequences of iodine deficiency. Apart from education, advocacy is just as important. We know that more can be achieved for patients when we come together with patients to drive change. In a recent roundtable discussion about thyroid eye disease hosted by TFI, patients were invited to share their own lived experience. It was very insightful for me to hear directly from patients about their journeys, their challenges, and hopes regarding future treatments. Patients need to be central to how decisions are made. The meeting was a wonderful reminder why advocacy matters, why patient voices are so powerful, and why collaborations across the healthcare community are so essential. Grateful for the trust placed in TFI across all communications, and we will continue to work for patients with focus and heart. Thank you.
This is your facilitator, Ashok Bhasin, and President of Thyroid Federation International. Here's a brief synopsis on me and how I got involved with Thyroid Federation International. I've been the president now since 2012, and I have had almost 25, 26 years of experience on the thyroid side, supporting the thyroid patients way back from 1999. And also in my family and some relatives are also affected by the thyroid issues, and hence I got involved. We'll go to the next slide. So Thyroid Federation International is serving thyroid patients globally since 1995. So this is 31 years of our operations. Thyroid World Day, which is 25th of May, World Thyroid Day, and Thyroid Awareness Week, which is always from 25th of May to 31st of May each year, is something that we started way back in 2007 and executed by 2009. These are followed by most of the endocrinology organizations around the globe. And 25th May is celebrated in many, many countries around the globe by making people aware and doing educational programs for the patients. We are involved with research, with advocacy, with market access. That means to make sure that our patients are getting access to the medicine at a reasonable price. We are involved with publication of our Thyro World, and also we are involved with our stakeholders in many initiatives, including research initiatives that we do on the disease state. Please visit our thyroid-federation.org website. So we'll go to the next slide. So our history, the organization Thyroid Federation International started in 1995. It was formed with 6 organizations from different countries in 1995 when the ITC International Thyroid Congress was held in Toronto in 1995. So the first president at that time was Dr. Larry Wood. Unfortunately, Dr. Larry Wood passed away this year in January, and we are very sad, but his contributions live on, and he was president for 8 years. Subsequently, we had Yvonne Anderson, who was the president for Thyroid Federation International for another 8 years after Dr. Larry Wood. And in 2012, I took over from Yvonne, and currently I serve as the president of Thyroid Federation International. We will go to the next slide. So our mission, aims and objectives, we work for the benefit of patients with thyroid-related disorders. In other words, I often say that we are the United Nations of the thyroid world. And education and awareness is something that is dear to our heart and close to our heart. That's what we do. And it's all evidence-based, whatever we do. Our objectives are to help establish patient organizations, work with endocrinologists, thyroidologists, and other specialties to improve knowledge and awareness on the thyroid disease. Promote and support research. Currently, we are undertaking research in thyroid eye disease and Graves' disease. Then other education and awareness initiatives that I will be talking about, and advocacy to make sure the patients have access to medicine and have access to healthcare. And our aims are to work with the United Nations that we're currently doing for NCDs, non-communicable diseases, and work with WHO to get thyroid eye disease recognized as NCD and keep it evidence-based. Global alliance with the European Thyroid Association, with Asian uh, um, uh, Oceania Thyroid Association, with American Thyroid Association, with Latin America Thyroid Society to promote best practices and to contribute and disseminate clinical practice guidelines. These are some things that we do. We go to the next slide. Membership criteria, how to become a member. Your organization should be a non-profit, non-government organization. Your organization in your country should have legal status in the country, following bylaws and constitution. Uh, every organization should have that if they want to become a member of TFI or if they want to operate a thyroid patient organization in their country. It should be patient centric and it should be evidence based and a national, it could be a national or regional organization, but one national organization can become a member of Thyroid Federation International, not all the regional organizations. Then also your organization should provide evidence-based information to thyroid patients, and it should be a fully independent organization, not a voice of a company or a government. So these are the criteria to be a member of Thyroid Federation International. Um, now, uh, we also have a patient tool kit that we have developed, and this toolkit is going to be available to our thyroid um, patient organizations, and they should contact us because this toolkit provides all the details how to form the organization, how to work the organization, what criteria are required, and how to function, etc. So all the details are provided in the patient tool for the thyroid patients. Next, we will go. So working to include thyroid disorders as NCDs, non-communicable disease. This was held last year in the World Health Summit. And prior to that, it was in Geneva. This was in Berlin last year. And this is basically what we do on policy integration, advocating for policymakers to include thyroid disease in global and national non-communicable plan and agenda, basically. So this is a team that we work along with it. You can see physicians, you can see industry, and you can see other patient organizations that are involved in making this happen. We go to the next slide. So this slide will give you at a glance of what we do and what we are involved in. You have already heard from all our directors before, but in a snapshot, we are a 31-year-old organization. We are a nonprofit organization, non-government organization, and World Health Summit, we work with them to include NCDs. Mother Baby Iodine has been a big project for Thyroid Federation International. EU Thyroid 2. On all these, when you Google, you'll find all these details. We work with the European Union to fund one of our projects. And also we work with Iodine Coalition Europe. We had e-empathy study. All these things you can see on Google search. And then we also have a Thyro Mobile project going on in Philippines, Nigeria, and Peru and countries like Mongolia, where I'm visiting here and speaking at the endocrinology conference tomorrow morning. In such places also, Mobile project can be implemented because people are spread in a very vast area, and especially during pregnancy, iodine requirement is very high, and 50% of the population of Mongolia fall short of that in the rural areas. So even in this place, it is important to have something like Mobile in the future. Thank you very much for joining the webinar today. And I hope this webinar has given you a perspective in what Thyroid Federation International is all about, what we do, who are the people behind, who are the sponsors, and who are the stakeholders. I would once again like to thank Merck, Amgen, Argenex, Viridian, Immunovant, Egetis, and IPSA for all the help that they have provided us in bringing this webinar to you. Without their help, it would not have been possible to bring this webinar. So I want to thank you very much for doing that. And next slide. So we would have further webinars on thyroid cancer, hyperthyroidism, MCT8 deficiency, Graves' orbitopathy, and thyroid eye disease. So keep an eye open for these. You will be getting emails from us on when some of these programs are going to be held, and we look forward to having you then. So thank you very much for joining us today. So and bye for now.